Ethical Perspectives on the News is produced by the Interreligious Council of Lynn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good day and welcome to Ethical Perspectives on the News. My name is Leon Tabak. I'll moderate today's discussion. Our topic is growing old together. In the United States and in many other countries around the world, the fraction of the population that is over 65 years old is increasing. And there are concerns that are financial and medical and social. We want to visit some of the questions about how we're going to care for this growing elderly population with three guests today. I have with me Brian Kramer, Marianne Smith, and Bob Wallace. And they each bring different interests and expertise to help us explore this question. So Brian, why don't you tell us a little bit about your work and your engagement with the questions we're going to discuss today.
Great, yeah. My name is Brian Kramer with Cottage Grove Place. I'm Director of Sales and Marketing there. And basically what we do, we are a CCRC in the community, a continuing care retirement community. Also the only life care community in the Cedar Rapids area. So basically what we do is we are giving an outlet to prospects in the area over the age of 62 to come. We have a continuing care of healthcare needs, whether you're in independent living, assisted living, whether you need the health center or you need rehab. And that's what we do there at Cottage Grove.
Okay, so we'll talk more about residential options for older people. We have on our panel people who bring some medical expertise, two guests from the University of Iowa. So Marianne, tell us about your role at the university.
I am Marianne Smith, and I am a nurse faculty member at the University of Iowa College of Nursing, associate professor, and also the director of our SOMACE Center for Gerontological Excellence, which is focused on really partnering with communities to engage in real excellent geriatric care using the best evidence that is available. And of course, that's based on nursing research. So my primary interest as a faculty member is conducting nursing research related to care and treatment of older adults with a big focus on those who have depression. So that is my area of expertise.
And Bob, you're in College of Public Health, is that right?
Yes, I'm a professor of public health. I'm also in the Department of Internal Medicine. I'm a physician trained as an internist, but not doing that anymore. I'm mostly interested in the health of older people in the community. And I work mostly on public health themes, and I've done a lot in a lot of areas. For example, recently I've been looking at ways to improve a disabling illness such as carpal tunnel syndrome, where the wrists don't work as well as they should. I've worked on keeping people healthy using devices. I've actually done a national survey of preparedness. That is, you may know that there have been earthquakes and fires and other rain and other natural tornadoes, natural disasters, and I've studied how to keep older people safer during those catastrophes.
So before we came together on the show, we had some conversation ahead of time, and I had prompted you with some of the concerns I had encountered in my reading, some of which were kind of gloomy and pessimistic. And some of you advised me that the topic we're discussing is not all gloomy and pessimistic. So help us give some balance here. There are concerns and there are reasons for some more positive views too. Maybe you could talk about the kinds of concerns your clients bring to you and reasons for reassurance. Maybe you can find a positive note for it as well. When you meet people at Cottage Grove here, do they come in with some concerns, anxieties? What do you hear from the people with whom you work?
Yeah, so when we sit down with people, we really want to get down to what their needs are, what they're looking for in their future retirement. And we really just try to get to know them and really let them know that there's a lot of different things out there in the community, a lot of different avenues that they can attack as far as living. But it all depends on what their needs are, what they're looking for, if they're having a health crisis right now, and try to walk them through that. And really, it's a very difficult decision that these people are having to make. It's one of the biggest life changes that they have. So we really need to sit back, listen to what their situation is, and go from there. So.
Bob, I've talked with some of your colleagues at the university who are using technology to help younger people with disabilities or difficulties enjoy a fuller social life. And I can imagine that technology could open doors for older people that weren't available to them in the past. And that might be maybe one of the brighter notes that we could...
Well, I think there are lots of brighter notes, but with regard to technology, just simple things like access to the internet and the ability to use computers is very, very important. There are some older people who have trouble with that because they never used computers in their jobs and they were not trained to use them. But that group is actually getting smaller, and I would guess that maybe 80% of older people know how to use a computer. There's a lot of other technology that's coming. Smartphones, vacuum cleaners that will run by themselves, and there are lots of technology inventions and devices that are coming, and it's only a question of what people want and how to best use them.
So in your work, Marianne, what do you...
I'm grateful to be able to address that question. We've actually got a group of collaborators at the University of Iowa called the Iowa Healthy Aging Collaboratory for Successful Aging, and it's a group of researchers that are working together with some industry partners to think about what are the technologies that will be most useful in helping people age in place. You know, how do we use sensor information? How do we use some of that smartphone technology that Bob just mentioned to create a living environment in which we can recognize problems before they actually become problems? And there's good evidence out there. There's a residence in Missouri called Tiger Place that is using that very type of sensor data to predict healthcare problems before they actually occur. So using changes in daily habits that will then allow us to intervene before it becomes what we would call an acute episode. So we don't necessarily know what happens, but we know that the sleeping patterns have changed, the daily habits of leaving the residence, the apartment have changed, other physiological measures have kind of weighed into a formula that allow us to say, wow, there's something different going on with Mr. Jones, let's check it out. And in so doing, they've been able to avert healthcare problems. And it's really powerful data and really persuasive, because I think for a lot of older adults, the threat of, there's a lot of discussion out there about, oh my gosh, grandma doesn't want somebody watching her all the time. But on the other hand, if that's the opportunity to continue being successful in the place that you would like to live, many times that's very persuasive, and people are very agreeable to using a device as simple as a Fitbit or having something underneath the mattress that helps monitor blood pressure or changes in habit that might help us better understand when they're starting to have some kind of a problem. So it's a real exciting area of research.
How does this play out in your facility?
We're going through an expansion right now, and we've kind of hem-hawed around, how do we, with the baby boomers coming up and and using the technology that they do, what do you put in the home?
Right.
It's it's kind of a big deal because a lot of the family members, whether they're young kids, have left the area or something like that. They now have an avenue to connect with them, just as far as the smartphone and using Skype, that types of things. So we're really looking closely at how we want to, what we want to put for technology into the homes for these people. So
Bob, you mentioned the internet as a medium that allows social interaction that wasn't available before, and Marianne, you concentrated on technology measuring physiological signals and so on. But I'll bet that there's a relationship between the social well-being of people and their physical well-being. Would either of you like to say something about that? Is that an area of research for you? Or?
A little bit. I'd like to raise the topic that one of the uses of computers would be, of course, to do work in the home. And more older people are staying on the job one way or another. Some of them are telecommuting. And of course, for some, this requires some training and so forth, and access to the kinds of services that it would take. But as people get older, there are a number of important things that they can do if they wish to do them that actually can use the technology, and particularly computers, as the workplace. And that's increasing. It's not easy for some older people to do, but it's easier for others. And because older people are working more than ever before and working longer than ever before. So technology, I think, is just one of those avenues.
And I would follow with that. I very much agree with what Bob said, and think that technology creates an opportunity to continue working. And working is important. Having productive activity is important. But to go back to your question about the interaction between our physiological well-being and our social interactions, of course, huge relationship. And we know that we can be physically well and socially deprived and have a very poor quality of life, and start having more and more health-related problems because of it. So I think that one of the greatest challenges in a lot of our rural communities where older adults are living alone. In Iowa, the statistics that the Iowa Department on Aging, for example, quotes is that about 45% of older adults live by themselves. So when you're living by yourself, how do you maintain social interaction? And I do think that technology provides some really wonderful opportunities. We've got great devices that allow us to interact with our families. On screen, I can not only hear your voice, I can actually see your face. I can see the new kitten you've got. Those are great things to be able to do. But I also think that it creates an opportunity to rally the community around the older person, and to say, if you're living alone, you do need to get out. And you need to be with other people, and you need opportunities for socialization, which is one of the great things that our senior living communities offer. But of course, that's not for everybody. So other socialization opportunities, I think, are just tremendously important. And we get at that through our churches and our neighborhoods, and the relationships that we have with other people and that we build with other people in late life. And so I think that my wish would be for all older adults to continue cultivating relationships as they age, and be thinking about who their friends and family being not just those biological relatives, but the family in terms of your neighbor and the guy down the road, and the person who shakes your hand at church.
Have you seen a difference between the two sexes in regards to this social challenge?
I'm don't want to tie up all the conversation,
Go
but
ahead.
I am a little biased. I do think that aging
Yes,
in a
you
lot
are.
of, yes, I am. And I'm self-confessing my bias.
Okay.
That I do worry that late life can be a women's issue because women tend to outlive their male counterparts. They do tend to have, in the past, in the current cohort of older adults, to have worked in lower wage jobs, therefore have less income. Now, that said, women are also remarkably resilient and hardy and have very creative ways of making the best out of the worst of times. So I am concerned about my female companions out there as they age, and at the same time I have a great deal of confidence that we'll figure it out together.
So I'm concerned, maybe you step in here, Bob, or Brian, that men have thinner social networks, so they may be more vulnerable to some kinds of, is that the case, or am I just looking in the mirror too much?
No, I think that's true.
Right.
I think that is true.
You know, part of it is that, as Marianne said, that men don't live as long, so their social networks thin out a little bit quicker, and so we need to pay attention to men who can sometimes get lost in a social environment. And I don't know that that's been studied as much as it needs to, and so forth. But I mean, I think the fundamental point is that social engagement, to the extent that it's possible, is really important for everybody. And I think that's why a lot of people stay on the job longer, is it provides one of those sources of personal communication, not with a machine, but with real humans.
Right.
And that becomes important.
So I wonder if for many men it's still the case that their social life is in their work, and when they leave that workplace, they leave behind a large part of their social life that they might have difficulty replacing. So tell us about your clientele and what you do to help them along these lines here.
The great part about being at a community is that we have a wide variety of women.
Yep.
We have a wide variety of men. We have a wide variety of couples
Okay.
that all have different backgrounds. And the best part about being at a community is that somebody coming from their home, they don't have to go out and look for that social interaction because it's right there. And it's a daily part of living at Cottage Grove or any other community that you step out your doors and you're going to run into somebody else. And there's those activities at the community that you do with other people. So that's the great thing about it, is being in a community like that. You don't really notice it a lot just because everybody's kind of doing the same thing, and they're creating friendships and not really having to work hard at it because it's all right there in front of them.
So help us understand, I think it's worth taking some time here to understand what kinds of residential options are available to older people. You gave us a term that described Cottage Grove. What are some of the other kinds of facilities? How does Cottage Grove stand in comparison to the others? How many facilities are there like Cottage Grove? How many of the other kinds, and so on?
So Cottage Grove is the only life care community in the Cedar Rapids area. And we are also considered a CCRC, which is a continuing care retirement community. So we offer all levels of higher care. So you start in independent living, assisted living. You have your health center that we have there, 24-hour skilled nursing. We also have rehab services, and we also have beds for memory support. So basically we are a one-stop shop as far as any levels of care that you may need in the future. Now, there's different types of contracts. We are considered a Type A contract. And then throughout the community of Cedar Rapids, Marianne, you have Type B contract, C contracts. And they may not mean anything by saying that, but what happens at Cottage Grove is you put down an entrance fee,
Yep.
a one-time entrance fee, and that entrance fee is basically paying for any future healthcare needs that may be needed in the future. So what happens is you pay an entrance fee at one time, and then you pay a monthly fee going forward with all your services and amenities included. And then if you were to transition into an assisted living or the health center, your monthly fee, because you've already prepaid that in an entrance fee, will not rise to the amount that you would normally see if somebody left their home and went to a nursing home of that sort. So all you would be paying for is basically 2 additional meals per day that the government says that we have to provide. So you won't see those high costs when you go to an assisted living or a health center.
Okay. You want to
Can I
Yes,
jump
please.
right in
Yeah.
behind you? Because I think you mentioned that there are different types or grades of continuing care, and you are a type A. So to backtrack a little bit, you might find the same continuum of care in another continuing care community with a different approach to how you purchase your services. And so there may not be an entrance fee. You may purchase a unit and then they buy it back from you when you transition to another area. I hear increasingly in my work, I do have a great focus on assisted living residences in my work in depression, and hear a great deal about in that continuum where it's assisted living and independent living, and maybe we have a nursing home, but we're working really hard now to use a healthcare model, a home healthcare model in senior living so that people don't have to necessarily move. You can get the same services in your assisted living apartment or your independent living apartment as if you were going to a higher level of care, which is really good for older people. So to backtrack out of senior living, there are also group homes for older people. There are some really interesting initiatives going on where the elder who owns their own personal home develops a plan to have rentals of rooms to other seniors in a living community where they share the old house, as long as everybody's got the capacity to do the steps, you know, and have a shared living community in someone's home. There are some models going on in Iowa City, or rather a model in Iowa City, where a group on the north side of town realized that they're all want to age in place in these old houses, and they put together a group, and they've developed actually a collaborative to help themselves age in place. So it's community living and residential living and assisted living and senior living. And nursing home really is a tiny portion nowadays, and really increasingly reserved for those who are the most medically frail. So I think that, well, a lot of people tend to equate old age with living in a nursing home. That just isn't the case much anymore. And we're trying to make it less so all the time.
Bob, there's some public policy questions that come in here. There's some public agencies that help the elderly. And we might want to urge some of our viewers to make themselves aware of the political dimensions of this problem or to become engaged with some of those issues. Do you want to speak to that?
Well, let me, I'll do my best with that, Leon.
Okay.
Let me,
You can,
there are a couple of other points that I wanted to make
okay, sure.
about health. First of all, about 2/3 of older people nationally and in Iowa say that their health is good or better. Okay, so we're not looking at people who face a lot of severe health problems all the time. Mm-hmm. That simply is not the reality. And so I think the viewers here and others should understand that a lot of their health, even in older ages, still depends on how they take care of themselves. Okay. And prevention is still the word, and they should get their vaccines, which can prevent the number of illnesses they need. well-rounded diet. They need to have enough resources to keep the temperature up in the winter and down enough in the summer. They should get out and exercise, even if that's just walking. All of that is helpful and is known to maintain health. We talked about the social environment before and so forth. So to the best that people can do that, they need to be informed, and they need, with the help of health professionals, to take care of themselves. And there's a lot of prevention that can be done. Some of it is different when they were younger. They don't want to trip on the carpets, for example, and they have to be careful how they walk. But a lot of things can be done, and one shouldn't sell that short.
Okay. We're coming close to the end of our discussion, so I want you to think about other topics that we might have missed that you want to comment on here before we conclude. It occurs to me some of what we might want to say, if I may suggest one, you can talk about something else if you like, is messages we want to give to the younger people in these families as to how they can be helping or what they should be aware of, how they should be educating themselves to be the best sons and daughters that they can be here.
From what I see at Cottage Grove, we have a lot of adult children that obviously that come in and are asking those questions for their parents, and to tell those adult children, just sit down and have that conversation and come up with a plan. Some of those conversations might be a little difficult, but there's ways to go at it, to ask those questions, and really talk to your parents about what would you like if this came up, or where would you like to go, or what are your plans? Because I don't think anybody likes to go in that crisis mode as far as an adult child when something happens to mom or dad and you don't know, it's not there. So great time during the holidays to come up and ask, bring up those questions. It might be difficult, but just continually trying it and trying it and trying it. So.
Yeah, I would follow on that and say there are wonderful programs offered by the national government about how to get together with your family and have the conversation. What do you want? What's important to you? Where are your values? Listen to the older person and don't project your own set of beliefs onto them. Let them tell you what's important to them. And then get it in writing. Go ahead and develop an end-of-life plan. Iowa iPost, I believe it's called in Iowa. Great decision making, put it in writing for your physician, keep it with you. Can make all the difference in the world with stress in later life.
Okay, so I'm going to take a different approach. I agree with everything that Brian and Marianne have said. How much time do we have?
We just have a minute here. You get the last word.
Okay. I would say to the children, the adult children and families and others taking care of people, that they should take care of themselves. They need to keep themselves trim. They need to have a good diet. They need to exercise. They're tomorrow's elders, and they're going to take all that baggage with them.
Good point.
Okay. Well, that's a great conversation. Thank you very much for joining us on Ethical Perspectives on the News. See you next time. Thank you very much.
Thanks.
Thank you.